Now, the second group of diseases we're going to be discussing in this unit is infections. So we discussed the diseases that we could get due to immune disorders, AIDS and systemic lupus. Now, some examples of infectious diseases, and we're going to start with the STDs, the sexually transmitted diseases. Sexually transmitted diseases, I like to put them in kind of three entities. Sexually transmitted diseases presenting with discharge, and a famous example for them is going to be gonorrhea, discharge, or ulcers, and a good example of ulcers is syphilis, or vesicles. And the only example of genital diseases or STDs that present with vesicles is going to be genital herpes. So when we look to this mini case study, a 34-year-old man presents in a clinic with multiple vesicles on the penis and enlarged inguinal lymph nodes. What's next? You need to do a Zank prep to diagnose, do you need a viral culture to diagnose, or you can go directly to treatment? You can go directly to treatment with valacyclovir. No need to do further testing because nothing else will result in genital vesicles other than herpes. Treatment of herpes simplex type 2, the genital type of herpes. Vesicular lesion, you have vesicles, start treatment. And the treatment is acyclovir, valcyclovir, famciclovir. It's just one drug, and we have multiple varieties of. Acyclovir is the treatment of choice. What if we had acyclovir resistant herpes? How to treat acyclovir resistant herpes? Foscarnet. Foscarnet is the drug to be used whenever we have resistance to acyclovir. Sometimes the roofs of these vesicles is just lost, and we get de-roofed vesicles, and they look as if they were ulcers, and now the diagnosis might not be very easy on clinical basis, and this is where we need to do the Zank prep, and the viral culture is going to be the most accurate test whenever the vesicles are not obvious, whenever the vesicles turn into kind of ulcers. In pregnancy, we need to treat herpes infection in pregnancy because you do not want the baby to pass in a birth canal that is full of vesicles. Otherwise, if the birth canal is still full of vesicles, you have to consider CS, you have to consider cesarean section. But we start this acyclovir, which is safe, when you started at the 36th week of pregnancy. We want to clear the birth passages from these vesicles. So our genital herpes case study. The key features here are a 43-year-old female presenting with painful vaginal vesicles. In a male, the vesicles are always present and always obvious. In a female, the genital vesicles could be inside the vagina. So sometimes you cannot find something, or sometimes the patient herself will not be able to find, but in this case, the patient had painful vaginal inside and outside the vagina, painful vaginal vesicles. And the condition started with headaches and muscle aches for a few days, kind of vague symptoms, followed by strange stinging sensation in the vulva, and then it broke out into these painful vesicles. And the pelvic exam revealed tender inguinal lymphadenopathy, and this is another finding in herpes infections. You get tender, it's an infection, so you're gonna get tender lymphadenopathy, painful lymph nodes, and clusters of small vesicular lesions over the vulva and labia. Question 8. What subjective clinical data are consistent with the primary genital herpes infection? In this patient, what did the patient complain of? What are the patient's symptoms that will point to herpes? This stinging sensation, tingling, stinging, will point to herpes. Headaches, muscle aches, malaise. It starts as any infection with some systemic manifestations. The moderately depressed appetite and the painful blisters in the genital organs, these are the genital region, these are the subjective symptoms, subjective clinical data that will point to genital herpes. What are the objective, in question 9, what are the objective clinical data that are consistent with the primary genital herpes infection? The tender inguinal lymphadenopathy, the clusters of vesicles, and the red weeping erosions in the genital area, signs of ruptured vesicles, and the viral culture was positive for herpes simplex virus, and the vulval swab monoclonal antibody stain was positive for herpes simplex virus type 2, and this low-grade fever with warmer than expected skin that is consistent with viral infection also.